As the new year approaches, the state health department is urging all of us to only interact with members of our household for the rest of the week. The hope is to avoid a surge in cases. Joining us now is CBS 4 medical editor, Dr. Dave Hnida, and thanks for joining us, Dave. And Dr. Dave, Colorado was able to avoid a post-Thanksgiving surge, but should we expect to see a post-Christmas one?
I think it's going to be a bit before we learn exactly what the ramifications of the Christmas holiday is going to be. Reporting tends to lag over the holiday period, so we're really not going to probably know until we hit early mid-January before we start seeing the effects of Christmas. The good news going into Christmas is that our numbers have been coming down very nicely in Colorado. Our case rates are down, our hospitalizations are down, and our test positivity rate is down. We are running about 6% right now. But that still is not good enough. We are still running higher than we were back at the height of things back in the spring. Most of the outbreaks that we are hearing about are around the country, and they tend to be regional. I think Coloradans in general did a very good job over Thanksgiving and preventing a surge. The question will be is how good did we do over Christmas? I think that it's really important, though, to recognize that even though most of us did do the behaviors that we were asked to do, a lot of us still got onto airplanes. A lot of us still got together with people outside our own households. And I think if you are one of those people, you need to keep in mind two things. The one is that you probably should do some sort of a self-quarantine for about 7 days after travel or after you've gotten together with people outside of your household. Limit your outside activities with others for that 7-day period. You also might consider getting a test done at about 5 days or so after you have returned for travel or have gotten together with other people. I think the other thing to keep in mind is, we're still not out of the holiday woods yet, so to speak. We've got New Year's coming up, and New Year's big party time, typically tendency toward alcohol. And so we really need to be extra cautious as we try to celebrate getting out of this crazy year of 2020 and welcoming in 2021. But, we don't want to be spreading COVID particles. We'd rather, celebrate with holiday bubbles. So please continue to follow the recommendations according to the state health department.
Yeah, make sure that everyone stays safe, especially as we go to the new year. Now, vaccinations continue in our state with healthcare workers and nursing home residents getting either the Pfizer or the Moderna vaccine. It will likely be months before the general public gets the vaccine. Now, Dr. Dave, how much of the population needs to be vaccinated for things to go back to normal?
Originally, we were thinking maybe about 50–60% of folks would need to be vaccinated in order to get what's called herd immunity. In other words, we wouldn't be having really widespread community transmission of the virus. But as time has gone on and as we learn more and more about the virus, and it is a constant learning curve that we are on because this virus is so new, we're now thinking probably about 75 to 85% of people are going to need to be vaccinated in order to achieve some sort of herd immunity, meaning at least 3 in 4 of us are going to need to get vaccinated in order to be able to think about getting rid of our masks and getting back to some sense of normalcy. Now, the good news is as time has gone on, more people are becoming less vaccine hesitant. More people are saying they're more willing to roll up their sleeves in order to be vaccinated. And that's really good news. But one problem, on the other hand, is vaccine rollout and distribution has not been so hot. We've given probably nationally about 2 million plus vaccines so far. Originally, the federal government had said we'd be at 20 million at this point in time, and we're running well behind. So there are big problems with distribution and getting the vaccine literally into people's arms. And so that actually throws us behind a little bit. But the other piece of good news to throw into that is the fact that right now we are talking about the Pfizer vaccine and we are talking about the Moderna vaccine. But it does appear that within the next few months, we are going to have at least 2 more, if not 3 more, newer vaccines to also enter the market and become available for public use. And I think that really is kind of a key word there. Public. Right now, we're mainly immunizing folks who are in the highest risk group, first responders in hospital settings, those who have the most contact with COVID patients, nursing homes, and so forth. When we finally begin to spread out and administer the vaccine on a more widespread basis, more toward people in the general public, when we hit the spring, I think then we're going to get a better sense of how long it will take before we do reach herd immunity. And so I think that as we look through a very cloudy crystal ball at this point in time, best case scenario, maybe midsummer, when we can begin to say, well, you know what, maybe this thing is in the rearview mirror and we can return to some sense of normalcy.
You know, Dr. Davis, interesting that you talked about that being in the rearview mirror, because last week we talked to you about a new strain of coronavirus identified in the United Kingdom, and that strain has now been identified in even more countries. All right, Dr. Dave, what else have we learned about this new strain of coronavirus in the past week?
Well, really, it's confirming a number of things. Number one, it is out there, it is more contagious, and it is affecting more and more countries. Originally, it was just the United Kingdom that was reporting this new, more contagious strain. But in fact, it's now in more than a dozen countries. A lot of people are saying, well, is it here in the United States? And the answer to that is, yeah, it probably is here in the United States. We just have not identified it as yet. It is more contagious, meaning it probably takes fewer particles, fewer time of contact in order to become infected with this particular strain. Is it more severe? Not necessarily more severe. It does not give you a tendency more severe illness per se. But the problem with the mutation is because there is more virus potentially out there because of this mutation, the people who are at risk, older people, people with pre-existing conditions, they will get more severe disease. So that is somewhat alarming as we take a look at what is going on in terms of the spread of this. So the big question everybody has is, does this mean that the vaccines are not going to be very useful against a mutation of this coronavirus? And the answer at this point is we do believe that the vaccines are effective now. They will be as we go through this year, and it remains to be seen what will happen in the years to come. We think that when we look at viruses, that viruses typically take not just months to mutate to a point to where they need to have new vaccine development. It typically is many years. It can be decades before there is mutation. So I don't think at this point, at this time, we're even looking at an annual COVID shot, so to speak, but there may be a need for a booster at some point in the future. We will see. But I think at this point in time, even though there is this new strain going around, it is not as worrisome as we think it could have otherwise been, and we still need to continue to do what we're doing as we roll out vaccines and get vaccinations into the arms of people.
Dr. Dave, that's definitely very comfortable to hear, to knowing that, hey, this vaccine should be able to take care of everything from there, and we don't have to worry about this new strain. Dr. Dave, thanks for joining us, and we hope that you have a wonderful new year. And thank you for all the work that you have done, helping us out, especially in 2020. Now, we'll talk to you next Monday at 11 o'clock. And to get more coronavirus and vaccines questions answered, now to see all of our Q&A with Dr. Dave segments, just visit cbsdenver.com. We'll be right back.